bodybuilders have been using creatine for years for its muscle effect. You worsen and cause a much more progressive arthritis by doing knee meniscectomies. People are way overusing antioxidants, and it's a problem. I think that the SGLTs with the GLPs are going to be really more and more in the forefront as longevity drugs. Endocalyx Pro, which is a supplement kind of aimed at protecting and restoring.
Welcome to our Q&A highlights. Q&A sessions are recorded every month, and our enhanced members get an exclusive opportunity to ask questions from one of cellular medicine's brightest minds, Dr. Elizabeth Yurth. Get a chance to ask your questions by becoming our enhanced member at bli.academy/memberships. You also get access to our content library full of tips, articles, videos, lectures, previous live Q&A sessions, and more.
People are way overusing antioxidants, and it's a problem. The free radical theory of aging came out in the 1950s, and it was sort of the answer to aging. You know, in the 1950s, it's like, okay, if we just get rid of free radicals, everybody will live forever. And then we found out that it was really a lot more complex than that. So everybody started taking lots of vitamin C and vitamin E and resveratrol and, you know, and tons of glutathione and all this stuff. But the theory has really been very questioned and refined. So we now know that oxidative stress is both beneficial and harmful, right? The key is the balance. We need some oxidative stress. In fact, those reactive oxygen species play a really vital role to signal our mitochondria to trigger really important adaptive responses. So it's absolutely critical to have oxidative stress. If you blunt all that oxidative stress, your mitochondria will not function as well. So you'll get mitochondrial decline, less energy over time. So, you know, short-term benefits, maybe getting rid of some antioxidant stress, the long-term not so. It's really a lot of really good studies in exercise. So if you're trying to build muscle or endurance and you're taking antioxidants, exercise promotes oxidative stress. If now I go pound a bunch of vitamin C and vitamin E and resveratrol, I've just undid what I wanted to do with exercise for my muscles. So really have to be key. Make sure that you're not timing it with the harder exercise days as well, if you really still want to take a bunch of antioxidants. You know, and then we're starting to see like the SELECT trial, which looked at vitamin E and increased risk of cancers with high dose vitamin E. And I think that's probably, especially the prostate cancers, probably because of this disruption in this oxidative stress. So I think that the key here is use them judiciously, intermittently. So let's say you had a big stressor, you were sick, something like that. Pull in some vitamin C, pull in some vitamin E, you know, do those things, do them for a short period of time and let your body get back on track. Okay. So what I like to do is cycle antioxidants in and out depending on stress states and use them appropriately when my body is in more of an oxidative stress state, too high of an oxidative stress state, like I just ran a marathon, or I just recovered from a bad viral illness, or I just went 4 nights without sleeping because I was traveling, something like that. That might be an appropriate time to use them. But I think otherwise, the key is going to be really focusing on the ways that your own body reduces oxidative stress, which is adequate sleep, adequate exercise, eating healthy, and then pulling in things like mitochondrial targeted supplements like coenzyme Q10, geranyl, GG, PQQ. Those are supplements that are going to help the mitochondria to appropriately manage oxidative stress themselves, as opposed to just taking all their free radicals away, which has created a disruption. So in summary, I think the free radical theory of aging has been pretty much sort of debunked. I think that there's a lot better explanations. We now know that cellular homeostasis is the key. We have to not disrupt cellular homeostasis. And so those of you who love taking all, you know, your very high doses of antioxidants all the time, probably that's not a good thing. Now, again, there's times to use it. High dose vitamin C can be extremely valuable for healing and recovery, for cancer patients, things like that. So I'm not saying this, we don't ever use these. We just use them appropriately. If you are over the age of about 25, the studies have well shown that you worsen and cause a much more progressive arthritis by doing knee meniscectomies. So if you look at the evidence against surgery, 2017, huge study done published in British Medical Journal. It compared looking at people who had an arthroscopic partial meniscectomy to a sham surgery. They stuck a scope in there and they didn't do anything in people with degenerative meniscal tears. So meniscus tear surgery versus sham surgery. Stuck a scope in but did nothing. The group who had the sham surgery fared much better. They were functionally better at 12 months and had less degradation of the joint. So in other countries now, Sweden, Finland, UK, they don't even allow the surgery anymore because it's been shown to be so ineffective. But now we also know the other thing that's happened is multiple long-term studies are showing that when you remove that part of the meniscus, even if it's damaged meniscus, you're actually setting people up for more cartilage progressive wear and damage. You're creating more of an inflammatory response. You're causing more osteoarthritis. People who have had surgery versus people who have been treated conservatively at 5-year follow-up and 10-year follow-up have progressively significantly more arthritis. So unless you have a locked knee, like the knee is stuck in a bent position because the meniscus is flipped into a position where you can't straighten the knee, there is no reason to do surgery for a meniscal tear. If you're young and you had a traumatic meniscal tear and it's reparable, then there may be, but not in people who are middle-aged or older. The key is, how do we treat these? Get rid of the inflammatory response because that's what's doing a lot of the damage and not allowing you to heal and recover. And then doing things like platelets, stem cells, exosomes, other procedures to help heal that meniscus up, but the key is, even I have, meniscal tears in my knees. It doesn't matter. They don't hurt. They don't bother me functionally. It doesn't matter. It's not the tear. It's the inflammatory response. So key is get the inflammation down, help the body to heal as much as it can, stay away from surgery. So GHK copper, topically, really good for scarring. We can order that for you. It's great. You're just applying that twice a day over the scar. The GHK copper, widely studied. It stimulates fibroblast activity, enhances the antioxidant defenses, modulates the inflammation. Widely studied for skin repair. Earlier, you can start this, guys. If you have a wound, start GH copper right away. But I want to tell you something that just kind of came to market. We were fortunate enough to get exposed to this a while ago. So we kind of started working with the company early on because some of you guys have seen Kristen, one of our client care coordinator stories, where she has had multiple Mohs procedures on her head, on her face, and really severe, really bad. I mean, we took like basically a golf ball piece out of her forehead, and it was not doing so well. So we actually got connected with a company that makes a product called Reyagel. And Reyagel was really only being used in hospital settings for severe wounds, but they were recently starting to come into more of a market with people with less, like not in a hospital setting. And so I was lucky enough to get my hands on it. It was remarkable. So we started using that, and we've been using that now for wound care, and it's probably one of the most remarkable things. So we can hook you up with that too. But Reyagel is something to keep your eye on, guys. Not everybody has access to it, but it's basically a biologic tissue matrix. So it's derived from sort of fibroblast and extracellular matrix components, and it provides a whole scaffolding that promotes cell migration, angiogenesis, tissue repair in exactly the same way your body would be doing it. So I think that Endocalyx Pro, which is a supplement that's kind of aimed at protecting and restoring the endothelial glycocalyx. And really the key ingredient here is a fucoidan. So it's made from a seaweed. So it's a fucoidan that appears to be really beneficial in restoring glycocalyx function. Now, again, are we measuring it correctly? Don't know, but it does appear to have some benefit based on all the things we can actually pull from our knowledge base right now. So I do think it's a beneficial supplement. I think you do have to use it along with one of the fibrolytic agents that you talked about, like nattokinase, lumbrikinase, or seraptase. But of those, nattokinase is by far the best. So creatine is a vital player for brain and muscle. It made it, bodybuilders have been using creatine for years for its muscle effects, but we've only recently found how important it is for brain function. So when you look, creatine is part of this system that regenerates ATP. So this phosphocreatine system is what helps to regenerate ATP. That's your energy, right? So there's numerous now randomized, placebo-controlled studies showing that people with exercise put on muscle more easily, endurance is improved. There was a great meta-analysis that looked at just bench press and squat performance, doing nothing else different, no change in training regimen, no change in diet, and there was significant improvement in both squats and bench presses. So we know it's helping to build muscle. But when you look at the brain function aspects, which I think may be even more important to a lot of people. Not that muscle is not important, it is. Because of its role in ATP production, there's a high ATP demand in the brain. So because creatine is crucial for buffering energy during really sort of high stress tasks, something that really seems to help the brain to not burn out a bit. Also showed there was a great study in 2007, so a pretty old study showing that in people who weren't getting enough sleep, if they took creatine, they could score equally to people who were getting enough sleep on memory tasks. Otherwise, they scored more poorly. Neuroprotective effects in Parkinson's, ALS, traumatic brain injury by stabilizing mitochondrial function. There was a study, in Trends in Neuroscience like 15 years ago that showed that there was improvement in all the neurodegenerative diseases because you reduce the mitochondrial dysfunction in the brain. So I love the SGLT2 inhibitors. I mentioned them early on in the rapamycin conversation. I think that the SGLTs with the GLPs are going to be really more and more and more in the forefront as longevity drugs. What they are, so when these are what are called sodium glucose co-transporters. So what they do, these are proteins that are found in the tubules of the kidney, and they reabsorb glucose. So when you eat glucose, they reabsorb glucose and sodium back into the bloodstream. So basically, you put the glucose, sodium back into the bloodstream. What the SGLT2 inhibitors do is they block this action. So instead of the glucose being reabsorbed, so your serum levels of glucose get high, it just gets excreted in the urine. So basically, you just pee out extra glucose. And that's an elegant mechanism. But they also target a whole bunch of other things, much like the GLPs. Because when you promote this glucose loss, probably that metabolic stabilization is huge for longevity. We're going to have lower insulin demands, which we know is huge for longevity. But they also activate AMPK. They inhibit mTOR, so like rapamycin. Activate AMPK, inhibit mTOR, important parts of the aging regimen, right? They induce sort of a low-level physiologic ketogenesis, even in non-diabetics. So when you do that, you support more energy production. So you keep people in a little bit more of a ketotic state, probably because they're spilling a lot of the glucose out. We see much lower systemic inflammation when people are on these drugs, lower CRPs, lower interleukin-6, and probably really good cardioprotection. So the studies on heart failure risk patients markedly improve with the SGLTs. People with kidney disease markedly improve with the SGLTs. There's some promising brain health studies going on right there, neuroinflammation. So I think much like the GLPs, these are really an incredible tool. SGLTs, the biggest problem with them is they're super, super expensive. So if you're not a diabetic and you want something like Jardiance, which is an SGLT inhibitor, it would be about $2,000. But we can't get them compounded, so we can get them compounded for less money, still not inexpensive.